And Dr. King will be speaking to us today about advances in supporting children and youth with anxiety, the role of parents in schools. Thank you very much, Colin.
Wonderful. No, well, thanks, Jen, and thanks everyone for spending yet another hour here in front of a virtual screen. But hopefully I'll kind of make it worth your time there and leave some time there for questions and discussions there at the end, because I think each time I do presentations like this, I'm really excited by the dialogue and feedback that we're getting, and hopefully you'll see actually some of the parent feedback and feedback from our clients and youth along the way there have also kind of guided where we are here today. So thanks so much for joining. So my really kind of goal for today, oh, you have to get used to the advance, there we go, is to provide a little bit of an introduction here around anxiety, to look at some of the challenges that we do know exist around treatment for anxiety, what's getting in the way of that. There will be a bit of an education component looking at some of the core elements in anxiety treatment, so that when we're then talking about potential applications, thinking about with educators or with parents, kind of we'll have a shared understanding there. But then really look at some of those challenges and opportunities with caring adults to use some of these ideas. And really that's led to the development of a parent-led anxiety program that we're launching here at the clinic, and certainly kind of in our research as well. And if we have time there, a brief case example to share how this really kind of played out with a parent and a youth there. So as a bit of an introduction there, I guess I really wanted to kind of situate myself in terms of the experiences and lens and biases, certainly that I kind of bring to the work as certainly as researchers there. Sometimes we do our best to be removed and be neutral, but really I think when we have a nuanced understanding of how we're approaching our research and lens there, that absolutely our experiences really kind of guide that. So as a bit of an introduction here, and certainly my work as the director at the Child and Youth Development Clinic has been a key piece in that, as you'll see moving forward. But certainly my experience working in other settings there as well as a school and clinical psychologist. So spending about 7 years there working in the school system, working with educators, students, working in private practice setting, also in outpatient kind of mental health, some similarities and differences there. And when I certainly look at some of the values, I think that really kind of guide my work and really kind of treatment approaches there, that they really are kind of focused on skill-based, about really believing at the core that these are skills and strategies that we can teach, that can be shared across settings, that we can collaborate together on. So it's not just about the child or just about the family, but that we can involve other significant caring adults and really have that kind of shared understanding. And also a bit of a kind of a bias and a lens there too, that really that there's not, a fix for mental health. It's really more about management, particularly around anxiety symptoms. So certainly that's kind of a lens that I bring to the work. And lastly, certainly on the kind of the lived experience side, I think, looking back with the lens now as a professional, knowing that when I was a kid, I probably would have struggled, which would have been kind of more problematic anxiety. So certainly having that kind of professional and lived hat is also really guided my work. I think about that 90s commercial there for the hair loss club for men. The president there saying, I'm not only the president, but I'm also a client. And I have that kind of shared dual role as well with this work. And actually, that's another club I'll be joining down the road. But on to talk about anxiety treatment. And I would be remiss if I didn't really share how the development of these ideas from our research lab. So certainly being here at Western now 3.5 years and coming from a very applied setting, it's been a real treasure to be able to develop the foundation of these ideas and core elements there with our graduate students. And our lab is really focused on how we can increase our understanding, application, and mobilization of some of these core ideas from our psychological knowledge. Really looking at childhood anxiety and some of the work on student variability. How can we extend what we know from our psychological evaluations and reports, and in particular build bridges with our community and schools as well. And I know several of my students here are on the call today, but quick shout out to Chelsea, Sydney, Laura, Alex, and Prachi. Their work as graduate students and volunteers has really been essential, and it's been great to be working together here, kind of building this body of work. So as a bit of an introduction here, when we're thinking about anxiety, we do know that anxiety disorders, so if we're thinking about kids who would meet criteria to be labeled with kind of an anxiety disorder, is really one of the most common forms of kind of mental health problems. And different prevalence statistics are out there, but it's approximately about kind of 6% of kind of youth at any one time. And we also know that certainly from the early 1980s to now, that we have seen an increase in youth kind of seeking professional support. So the Ontario Child Health Study there, that particular research group there, and you can see the difference in the increase from about 7% to about 1 in 5 children seeking support for kind of interfering kind of mental health symptoms. We also know that, particularly looking at more specifically around anxiety, that anxiety symptoms can be effectively managed. Certainly not for everyone, but if we're looking at a large group of kids who might be struggling, some of our best estimates there, about 75 to 80% of youth would get better with some professional support. And as we're thinking about anxiety, particularly in the context of this presentation today, I really want you to be thinking about almost this idea of kind of an iceberg. At the kind of the tip of the iceberg there, what's above water might be some of the anxiety disorders, those 6% of youth that would meet criteria, but also recognizing that underneath that iceberg, underneath that waterline there, is a large number of kids who are really struggling. And that's certainly showing up in some of the data there in Ontario, the Ontario Student Drug Use and Health Survey from the Centre for Addiction and Mental Health, one of our longest running kind of longitudinal studies with kids grade 7 to grade 12, so that's 12 to 17-year-olds. And you can see some of the numbers there. I mean, large percentage of our kids who are really struggling with psychological distress or really problematic levels of stress. And it's really kind of my contention that as much as we're talking about some of these ideas here today that are really kind of essential for kids with anxiety disorders, that they're really beneficial for some of those children and youth also really kind of struggling. And we do know that for treatment for anxiety, that cognitive behavior therapy at this point is certainly one of the most promoted and evidence-based, well-researched therapies and approaches there. So if we're looking at practice-wise, they're a group really responsible for surveying research evidence and providing different levels of support. So you can look at there some of the level 1 best support metrics there and just how much CBT is coming up. Certainly Philip Kendall there as well on the right-hand side really advocates kind of a stepped care approach, thinking about more concerning anxiety, that as we're kind of increasing in anxiety interference, anxiety symptoms, that we've got a matched and appropriate kind of level of treatment and support that goes along with that, all the way to kind of step 5 being more intensive programs, perhaps kind of more hospital-based or kind of inpatient community. All the way up to kind of perhaps more first emergence anxiety symptoms there at level 1, where it's more about gaining some knowledge of what's going on right now or involving kind of caregivers in some of those kind of next steps. And when we think about CBT, for those of you who may not be as familiar with that, really is an active experiential form of therapy. That focus often being around skill acquisition. And when we're thinking about skills, that it implies also kind of practicing. So it's not just, kind of the magic of what happens in that 50-minute hour, but the idea that we're using it outside of session. And often that has kind of a homework or a practice element. Again, that idea of you're kind of using these skills and strategies when you need it. Mentioned kind of that strong kind of evidence base there. And it's really looking at the interconnection and reciprocity there across these 3 elements about our thinking, our behaviors or actions, and the feelings or emotions attached to it. So if we think about that as being, if you've heard about the CBT triangle, it really is this here about recognizing the bidirectional relationship of how we perceive a situation is going to be influencing our feelings and the responses we take in that moment. But conversely, about how we're feeling and the things we're doing, that it also has an impact on our thinking processes there as well. And when kids are really struggling with anxiety there, you can really see how they're having a hard time really from all 3 sides there, but it really getting in the way. And the benefit of that is that it also gives us an opportunity there to intervene at those different points at the triangle. And I think about a month ago there, you probably heard from Dr. Karen Bax around the M3 program, which really has a foundation in some of that more mindfulness based about promotion of resiliency, a great development in next step there, really focusing on some of those key elements. And certainly here at the clinic, we've really had almost kind of an active laboratory in the sense of really being able to kind of experiment and manipulate various different and develop different treatment models really along that stepped care kind of continuum, all the way from kind of more step 3, step 4, where we're looking at more intensive child and parent-based programs. We've had kind of 8 and 12-week programs here at the clinic, all the way down to individual CBT with kids and parents, and that can range from anywhere from 4 to kind of 12 sessions. We recently were experimenting with a parent-led program, so 4 weeks with the parent, but we also had kind of complementary child-based sessions. And certainly in some of those early stepped care models there as well, as we've had other types of entry points. So thinking about a 3-hour workshop we had at the Faculty of Education with about 57 parents there, certainly kind of pre-COVID days. And we've also done other kind of shortened PD there as well with educators, early childhood educators, really trying to have some informed discussions about anxiety and where they could see their role or potential next steps. So all these different avenues around support have been extremely helpful as part of gathering feedback and thinking about what was meaningful in that particular support or session. And we've also been really active here at the clinic there as well about really trying to have some creative ways of extending our knowledge and kind of lessons learned from group and from some of the supports. So this is one particular kiddo, just kind of a template here, but shared, they participated in our A-Week program. And we had these kind of summary reports that were really trying to share what anxiety looked like, felt like, and what strategies were helpful for these kids as part of managing their anxiety. So you can see here on the left-hand side what types of situations and demands make me feel worried, what does it feel like, what happens to my thinking, and what are some of those skills I learned in group and some of those possible kind of next steps. And again, that was really done with the idea that we can involve some other caring adults, and whether that's the gymnastics instructor or the hockey coach or the neighbor or grandma, grandpa, or certainly at school around educators or other support professionals there, that we can begin to build a community around our kids, understanding what their experience is like and what skills might be promoted or encouraged in those more challenging moments. The challenge, though, is that certainly when we're looking at the literature around cognitive behavioral therapy, there is that there are a number of different barriers. So certainly access to mental health services is common. Children's Mental Health Ontario has done kind of ongoing wait lists in different communities, and kids having to wait up to a year and a half for kind of a first episode anxiety problem is just is just not okay. And we do know that when support is often provided, it's often around the use of medication as a first step, and that's often from a family doctor, psychiatrist, developmental pediatrician. And again, that's okay, but again, it's about having access to some of this evidence-based care, which is also really important. When you also survey professionals, and these are becoming a little bit dated here, but mental health professionals are also not endorsing some of the best evidence of what we know kind of works from some of the research literature. And what are some of the different kind of reasons for that? We also know that there's sometimes a lack of confidence on clinician end about using some of the core anxiety treatment components. We're going to talk a little bit about anxiety and what that kind of looks like. And also a lack of collaboration across settings. It very much feels sometimes for a lot of clients that these are kind of silos here where information is not kind of making it into other sectors and really kind of building a community. So certainly these are concerns and problems there that we really need to kind of address and work on. And one of, I guess, the responses to some of these kind of challenges here was this idea of the rise of what we call common elements. And this particular group, Bruce Torpeda and colleagues, they're really interested in some of the evidence-based programs that are out there for common mental health problems, whether that be anxiety, depression, more kind of behavior challenges. And what they're really interested in is, within these effective programs, what features are common or characterize successful treatments? And what are those ingredients across these different programs that actually might be able to be kind of promoted? So as an example here is, we've got a rise of a whole great bunch of different RCT evaluated treatment programs for children's anxiety. But again, what's common across these different programs here that we might be able to mobilize and use in other settings or other kind of forums there? So what they did was, certainly reviewing 500 plus studies here, was again looking at those kind of common elements and features. And what they found here is, again, perhaps not surprising, but is that there were a number of different common kind of active ingredients across the different studies here. So you can see here kind of right at the top, exposure, and again, we're going to talk a little bit more about that, being endorsed in about 80% of kind of those evidence-based programs. And from there, kind of a bit of a decline of other elements that were common across programs: relaxation, cognitive strategies, parental modeling, psychoeducation, also being some very common features, again, in these kind of evidence-based programs. So what I'm going to share here, because it does come across, and when we're talking a little bit about the, the role of parents and the role of educators, is this idea of exposure. And I'm going to be talking a little bit more about that. So what we are going to see is a clip here. This is from Anxiety Canada. It's a great clip if you haven't seen it before. Apologies to my students and lab mates here who have seen it here. But I want you to really kind of listen for three kind of features here. I want you to be seeing if you can appreciate, what are some of the details that of the situation that Millie's going into around exposure. What's her experience of anxiety within that kind of practice session? And at the end of it, what are some of the new learnings or evidence she has about anxiety based on kind of what happened here? So what I'm going to do is stop sharing this and pull up the video here, if I'm doing this right. Great, so hopefully you're seeing a young woman here kind of on the screen. And as a bit of a context here, you're going to hear Millie talking a little bit about some of her anxiety challenges and this idea of exposure, the idea of going into a situation that actually is anxiety producing and anxiety evoking, but being able to stay in that situation to a point where she's feeling that she has some additional mastery and confidence over that situation. So it's about a 2-minute clip here, so we'll watch this and talk a little bit about next steps.
Hey, it's me, Millie. So the doctor says that I have panic disorder, which means I get these really intense anxiety attacks that just come out of nowhere. And she says it's the reason why I don't want to go back to the mall or any of those other places where I've had an attack. But she says that it's important for me to stop avoiding those places because that just feeds my anxiety. My mom found this stuff off the internet that says one way to deal with a panic attack is to purposefully bring on the feelings of panic, like being dizzy, and sit with them. But I think I'm just gonna do that with my counselor. Right now I just want to go back to the mall. So today my mom's gonna take me there. Hey, I'm here at the mall with my mom. My goal is to walk around the outside of the mall until I start to feel less anxious. Here I go. Hey, I'm back. So I did it. I walked around the mall for about 20 minutes. It was hard, but especially at first, but I just tried to breathe normally And then I just kept walking. And I told myself that anxiety is not dangerous and these feelings won't last forever. So I did feel better. I suppose I'm going to have to keep going with this. Maybe I'll come back tomorrow and do it again. I think I'll sit on the benches at the front entrance of the mall with my mom. Right now I can't even imagine doing that, but I didn't think I could come here today, so who knows? Bye for now.
All right, so let me just turn this off here. All right, I'm just gonna, there we go, sorry here. Great, is that back up there, Jen?
Yeah, looks good.
Okay, great, thank you. Wonderful, great. Well, and what you could perhaps kind of hear in that particular setting there was, again, Millie doing this exposure here that really was personalized to her when we heard a little bit about the amount of time that she's spending in that location at the mall, actually walking through the mall there. It was all personalized to her skills and tolerance where she was at that point. Obviously, she had been doing some advanced work there with a psychologist to get to this point here. But again, it was really kind of designed and intentional is the key word that I'm really kind of thinking about. We could hear Millie talk about, it was challenging, especially at first, but that she kind of kept walking and it felt a little bit easier. This idea of habituation, of getting used to it and having some mastery over that. And lastly, when she was wrapping up there, some of the debriefing and the new learning pieces there about anxiety is not dangerous, that I can handle these feelings, they won't last forever. And you can hear some of that hope and confidence there from Millie there too about, I didn't think I could kind of do this. And that's what really some of the evidence is really showing now about it's that acquisition of new learning that anxiety often is interfering with, that is promoting, mastery and really competence about handling these kind of challenging scenarios. So I want you to just kind of hold on to these ideas here as we kind of continue to move forward about certainly this can reside, in the hands of kind of mental health professionals, and they're doing some of their work independently around that, around practicing. But what would that look like if we could create some communities where we have some shared kind of understanding around this? And just really quick here, you can see in that particular situation, the idea of exposure is that we're not doing it too much. So we're not doing it, a 10 out of 10 here where it's overwhelming for Millie. But at the same time, there are some steps here which she's already taken and probably kind of mastered as part of that. It's trying to find that just right point where they're feeling a little uncomfortable, but with skills and strategies, are able to kind of manage that. And you can see this kind of increase here again for anxiety around the anticipatory anxiety, being able to get over that hump. And so certainly near the end of the exposure there, Millie was feeling much more confident and feeling kind of more relaxed. I was able to do it. And often the goal in our anxiety treatment is trying to get out of this negative feedback loop here where kids often feel anxious, can avoid or escape these challenging scenarios, and then feel better. They feel less anxious because they're not in that scenario or being faced with those different demands. So again, we're going to hold on to these ideas here as we think a little bit about the role of teachers and the role of parents being able to promote these skills. So the idea here that really for the rest of the presentation here is thinking about, how do we build this community of care and shared understanding that would allow some real intentionality and shared language and understanding about where kids and youth and what their anxiety looks and sounds and feels like, the skills and supports that could be helpful. And being able to do that together, knowing that with that comes increased generalization of skills, increased competence and confidence as well, and increasingly being able to apply and manage in a whole range of settings and not just at home. So certainly kind of one idea around this here. advance, there we go, is thinking a little bit about the role of schools. We're going to talk first here a little bit about the role of schools. We do know that anxiety often interferes with academic performance, and that's pretty clear from the literature there, is when kids are struggling with their mental health, that their academic achievement also declines. We also know that anxiety management skills do increase when practiced across settings and with multiple people, whether that be multiple therapists or other kind of multiple adults there, because it's a focus on skill acquisition. We might reasonably expect them to be more effective and proficient in using kind of that particular skill. And some of the work that's been done in this area, particularly in kind of the UK, Jennifer Allen, using kind of multiple choice scenarios there, really felt that teachers are well positioned to support strategies that are anxiety reducing. And when you look at the whole range of possible responses there, that teachers were very likely to select strategies that were really focused on promoting autonomy and independence, providing encouragement and praise for being able to take next steps that are challenging, all that fit really well within kind of this cognitive behavioral therapy kind of framework. And certainly some of the work to date there around children's, so that should be SMHO, School Mental Health Ontario, is really beginning to promote some of these ideas as kind of everyday mental health strategies, about creating calm classrooms, being able to talk about our feelings, being able to use different grounding and relaxation tools, all as a way to promote positive coping and create an environment for more effective learning. So one strategy, our first really kind of work in this area as a lab, and this is some hot off the press kind of work here from Sydney Coleman and some of her results from her MA work, was really about looking at, with educators, using focus groups of, after being given a presentation, not unlike kind of the presentation here today, to be able to talk about what are some of those opportunities and challenges using cognitive behavioral informed strategies. Again, the idea here is not to turn educators into therapists or to assume those roles, but is there an inch and an overlap there where it's about kind of skill promotion? And certainly some of the feedback here, and looking forward to Sydney defending her thesis here later on in April, is that, you know, educators are well positioned, that they can recognize a lot of really that whole wide continuum and range of anxiety symptoms, particularly in the context of kind of tiered intervention, that they are seeing a lot of these symptoms in day-to-day classwork and achievements, and often in the context of that caring relationship. And educators talked about, you know, that there is some alignment already with some existing practices of what we're already doing in the classroom. And certainly that idea of exposure or scaffolding, being able to provide adjusted amounts of support as needed to individual students, was really an idea that resonated with them. Also, this idea of connection to the curriculum, that there are some certainly expectations now in health and physical education and even in mathematics where there's some wonderful segues and overlap there about being able to promote persistence and perseverance in spite of challenges, being able to reflect on our experiences and our thinking about a situation. And again, so maybe there's already some alignment there that we can really take advantage of. At the same time, there was certainly some concerns there as well about role boundaries, about making sure that this is, you know, they're staying within their lane and not getting into kind of professional territory. And really that need for collaboration and support was really a strong theme that came up, of really wanting to do this with families and mental health professionals on board there. So some really exciting kind of work in this area, and certainly I think from our lens anyways, they're one of the first to really dig and get at some of the educator perspective of what is this, could this potentially look like? So after our focus now, thinking a little bit about parents and families and caregivers, you know, what does that look like? Well, the literature, we know that there are a number of different kind of challenges there, and Chelsea Maston on the call here today too was really interested in, you know, what are the experience of caregivers seeking, who have sought support for their child and, you know, young youth here who's struggling with problematic anxiety. So these were kids under the age of 12 in southwestern Ontario. And what we saw from our sample there of 27 parents was that really kind of that wide range of supports that were accessed. So kind of more formal mental health supports, psychologists, therapists, family doctors, but also informal supports that were really accessed as part of this kind of continuum of care. But one of the, I guess, themes that really came back as being really strongly endorsed here was that, the majority of these families, despite accessing some of these supports, really did perceive a lack of support specific to manage those anxiety symptoms in their kids. And that was really respective of, whether they had a diagnosis or not. That these were problematic anxiety levels, and that pathway to care was really certainly not kind of clear cut, and families were really kind of dissatisfied with their experiences navigating those systems. And that certainly resonates with what we already know in the literature. And Southwestern Ontario is often held up as a beacon with kind of the range of supports we have here. But it really isn't fitting with the other literature there about perhaps that need to do something different. And there's really been a rise here of new programs and thinking about perhaps it's not supporting the youth directly, particularly for younger kids, but being able to work more effectively and efficiently with parents and caregivers. We know that there are many practical barriers that exist in supporting mental health, certainly from time, access, cost. And you could see that, even in our continuum of care there, to participate as part of an 8-week program, that's pretty significant. And certainly some of the authors and researchers, clinicians out there have been looking at these areas. Eli Leibowitz and his SPACE program, which is working directly with parents only. So I believe that was a 12-week program. Kathy Cresswell and her colleagues there produced this wonderful book, Parent-Led CBT for Child Anxiety. It's the idea that perhaps we can be efficient and effective here working with caregivers who are most directly connected to the youth, perhaps then involving the youth themselves. And Chelsea, as part of her continued work in this area here, did a scoping review, really looking at, okay, what's out there in the literature about some parent-led or parent coaching kind of based models. And the results, and perhaps this is not surprising perhaps to some of you, but that few evidence-based programs do exist. It is starting to increase, but those that do exist are often focused on medical-related challenges, different procedures or surgeries. And those that do exist often have a significant time component. So again, that SPACE program sounds like a wonderful program, but kind of 12 weeks. So again, that was a real nice contribution to the literature there as well, about showing, perhaps there's an avenue and a path of exploration here in clinical development that we might be able to mobilize and expand on. And really that's led to some of our kind of current work in this area. So really that brings us to some of the parent-led work here that we're really just kind of starting, that we've been using some of our cases here at the clinic as under the guise of kind of program development as we've been kind of refining our models. But really this is the idea of kind of working with professionals and caregivers together in kind of this parent-led kind of coaching model. Can we, using a brief model there that's flexible and using telehealth methodologies, whether that be Zoom-based or telephone-based, can this be perhaps an effective step as part of that stepped kind of management of care around problematic anxiety? So let's look at that a little bit more specifically. So the research question that we're really investigating here is, again, can a brief telehealth parent-led anxiety treatment support children and caregivers in managing anxiety symptoms? So we're really interested in certainly kind of the feasibility. Does this resonate with the experience of parents and caregivers? Does this seem kind of relevant and convenient to their ways and manners of kind of working? Is it effective, both on kind of the child anxiety symptom side, also about reducing interference or disruption around anxiety symptoms? And knowing that this is not a particular program that's required, dependent on diagnosis, really some of those questions about kind of what works for whom. Are there particular types of profiles or anxiety presentations there that this might be a more applicable or convenient fit for compared to others? So what does that look like? Well, it involves an overview session. So parents prior to COVID would kind of come in. Now we're doing it Zoom where it's an overview session of child anxiety. that has then 5 coaching sessions directly with the parent or caregiver. So we're actually not seeing the child or youth at all as part of this particular kind of model. No diagnosis is required, but I guess the threshold that we're really looking at is really about interfering anxiety symptoms. That anxiety is kind of showing up and is getting in the way for kids or families, certainly compared to kind of a baseline. And we're looking at an age range there of 5 to about 10 years, knowing that as kids are getting a little bit older, that role and involvement of the parents is going to be looking a little bit different there as well. I certainly probably wouldn't want to be working with a 14-year-old without the 14-year-old being a key partner as part of that. It involves 3 weekly sessions, so 1 session a week for 3 weeks, involving 2 follow-up sessions. And I'll show you a bit of a visual around that. And the idea is about, with some of these key ideas and modules that we have in our kind of back pocket as clinicians, can we work in a collaborative, personalized way with parents based on the anxiety presentation that we can use much more of a coaching role about how is this going to resonate with your child and your family? What do these strategies look like in terms of being implemented at home? What do you foresee as being some challenges in this regard? And being able to circle back around the next week of how did that go? What challenges did you encounter? How did that resonate with your kiddo? And being able to look at some of the different outcome measures in this regard. So looking at different measures of anxiety, parent stress as well. We know that can often be a key moderator or mediator about reduction in child-based symptoms. And also the clinician evaluation of, based on what we've heard, what's that level of kind of interference or disruption, and how's that progressing throughout the course of treatment there. So these 6 program components, and you can see, perhaps going back to that idea of kind of the common elements there, is that many of these elements are highlighted there already as part of those common elements that do kind of. So certainly we have anxiety education, psychoeducation for both the parent and the child. We have this idea of kind of exposure, and again, that's going to look quite different for each child depending on the situation and context that they're involved in. Cognitive coping, that's really kind of a domain there that includes things from externalizing anxiety symptoms for kids. So being able to see anxiety is not kind of within themselves as, it's a problem, say, with Colin and Colin's anxiety, but this anxiety that is, kind of getting in the way and is being a pain and perhaps bossing me around. It also involves strategies related to more cognitive appraisal, to really look at our thinking or anxiety's thinking about a situation and recognizing, again, going back to that triangle, how we perceive and make sense of a situation guides how we feel and ultimately how we respond. And lastly, in the bottom row there, modeling. So that's often focused on parents about really doing some confidence coaching on their side, about managing their own emotions when kids tend to get escalated. Because often we do have this generalization of anxiety in kids as, kids being withdrawn and shy and timid, but that's certainly not always the case. And we know that for some kiddos, as anxiety increases, the behavior can look more externalizing and present more as kind of behavior challenges or increased emotion rather than kind of more timidness or kind of more inward difficulties. So how do we support parents being that kind of calm center to be modeling to their child that this is okay, that you can manage, that we can do this together? Relaxation, so that incorporates a range of kind of mindfulness and physical relaxation strategies, being able to be personalized about how we're introducing that. Perhaps it's before situations that are anxiety really kind of promoting. Maybe it's before bedtime. Maybe it's actually when things are going well. Again, this part of the allure of this model anyways is to use our kind of common elements of what we know works, but being able to do this in a collaborative way with parents, knowing that they know their kid best, they know what's going to work, and knowing that the work with a 5-year-old is also going to look quite different than perhaps work with a 10-year-old, and this model provides some of that flexibility. And certainly last but not least, they're on more the adaptive problem solving side of being able to use our problem-solving skills when we encounter challenges and situations that are problematic. How can we deal with the situation and not let kind of anxiety run to the races there and overwhelm us there? Let's develop a plan in advance to tackle these kind of challenging scenarios. So within those kind of 6 domains there, it allows for some of that personalization. It allows for parents to be working with us as really co-creator, and again, using their knowledge of the situation and their child to think about kind of what might work best. So in terms of process here, so it involves this kind of overview, anxiety psychoeducation, kind of not unlike some of the initial slides that we first talked about, where we go through some of our consents, some of the different questionnaires that we're using as part of that. And really that's providing a shared understanding and platform there going into the coaching sessions, where we're selecting our different intervention goals to think about what area do we want to be spending our time focused on, and really doing some of that coaching with parents about here's kind of the idea, the strategy, what is that going to look like at home, when do you foresee yourself doing it, and be able to talk about how that goes once it's actually done at home or at other settings there. And lastly, it has those follow-up coaching components. So at kind of week 6, 2 weeks after that final coaching session, and then again 1 month later, be able to evaluate how things are going. Have other difficulties crept in? Have we plateaued in certain areas and we just need to kind of problem solve or troubleshoot some of these different ideas? Because again, that's some of what I love about this work is that it certainly involves both kind of the art and the science around anxiety treatment. If we've got these kind of core ideas, but be able to make meaningful in a personalized way to each child and family is really some of the art around that. So I thought I would share kind of one case example here, just in a couple kind of last minutes here, and then we can have some time for questions. So again, this is being shared with the family's permission as part of some of our kind of program evaluation and really almost quality development here as we've been kind of tweaking the model here. But this is Kylie and her mom that we had the chance to work with. And again, I never met Kylie, certainly in person or even virtually here, so being able to know of her from mom in particular. But Kylie was really presenting with challenges with sleeping independently at night, and a lot of what we'd call kind of reassurance seeking and safety behavior. So if Kylie had difficulty falling asleep, if it was about 15 minutes, she'd be coming down to check on mom, saying, I just want to know where you are you safe? I'm having a hard time falling asleep. A lot of sometimes going halfway down the stairs to check on things. Needing a lot of reassurance that things were going to be okay. And you can imagine there that her certainly sleep quality had deteriorated quite a bit over the last month when she was really struggling with this. Certainly not kind of being herself at school as well, being kind of much more teary, challenging kind of regulating some of those emotions when she ran into troubles. Usually a pretty confident, academically oriented kid who over the last month had really kind of struggled. So after that first overview session there, our 3 sessions with mom, we're really focused on 3 of those 6 kind of elements there. So certainly that piece around anxiety education. So mom being able to have a bit of a script of how she might be able to relay to Kylie about what was going on in those moments. Being able to externalize some of that anxiety and make the connections again between what anxiety was thinking in that moment and some of the behaviors in response, being able to come check on mom, needing reassurance. Being able to use exposure, this idea of in a very graduated way here, being able to really manipulate and modify her environment here so that she could experience success. So perhaps falling asleep independently there, over kind of 15, 20 minutes was too challenging right now. Because of presenting anxiety. So being able to tailor that of, let's have 5 minutes under our belt here where you're trying it before coming down. Let's try doing it instead of 10 kind of reassurances that things are going to be okay. What would it be like if we only did 5? this idea of kind of being a little bit uncomfortable, but being able to manage and have that confidence, hey, that this is something kind of I can do. And lastly, a good discussion there as well around kind of parent modeling. And of course, perhaps for anyone with young kids there, knowing that if kids aren't sleeping, parents aren't sleeping. And as Kylie was experiencing more challenges, mom was often coming in, in a much more kind of escalated fashion there as well, which of course we might expect. The challenge with anxieties, though, is that a lot of those nonverbal and verbal communications were actually increasing some of that anxiety. So being able to kind of model in a way that was really communicating some of that calmness, that understanding, but also that idea of mastery, that this is something I know that we can kind of do together. So in this particular case example, and we've had about 3 or 4 families here that we're in the process of kind of working with as we kind of solidify the model here. But for Kylie, there was actually no clinical decline in anxiety. And part of that was that she actually didn't meet some of those clinical thresholds kind of in the beginning. But at the same time, when we looked at different metrics there around anxiety interference, is that they were quite high around sleep disruption, kind of parent-child kind of relationship quality. And over the course of the 10 weeks there is that we did see a significant decline in anxiety interference around those key symptoms. So from moving from about an 8 to about a 3. And again, it wasn't that the anxiety didn't go away completely, but that by the end there, she was certainly feeling much more confident and feeling much more independent about how she was able to deal with some of that discomfort. And again, that was a progression there. I think it was about week 2, week 3 there that we really got a lot of traction with mom using some of these different strategies at home that also really resonated with Kylie there. And again, we were able to maintain that progress at 2 time points kind of following up on that. So it's just a really kind of brief synopsis there of, again, being able to take some really kind of interfering disruptive anxiety symptoms that may or may not be anxiety diagnosis dependent, and be able to kind of work with parents in ways that really are kind of fitting their situation, but also their kiddo as part of that. And certainly some of the other cases that we're currently working with is that those 3 sessions actually look quite different. And the model provides for some of that flexibility. And these are just some of the handouts there that we were using as some of the as part of this kind of program there. And again, mom working collaboratively with Kylie to think about, what are some of those kind of first steps there as part of doing some of this exposure. Maybe it's not sleeping independently right now. Maybe that's in the really, these things are really hard to do camp. But maybe we can begin to start moving towards that path, knowing that as we're progress and move up the ladder there, that things are actually going to get a little bit easier because we're building skill and confidence along the way. So it's about 10:02 here, so I'll just to wrap up a little bit as part of kind of next steps on the parent-led treatment side here. Certainly we're, COVID keeps getting in the way here, and parents are already quite stressed, and having some additional obligations there has really been hard for families. But we're looking at really launching the study in kind of a research capacity in May and June, looking at future development of being able to compare to a waitlist control or perhaps to another form of support, looking at maybe some of the PD or knowledge side only. Again, is it knowledge that makes the difference, or perhaps it might be some of that coaching model? And continued work with our educators in schools here as well to find that overlapping inch of particularly anxiety support strategies. We already know that educators are doing tons to support our kids in the classroom. And what are those kind of segues and overlap? What are they already doing there that was some of that increased, intentionality and focus could really be aligned with kind of an evidence-based kind of school model there. And lastly, really looking at some of these strategies here that are kind of essential for some students struggling with anxiety symptoms, certainly kind of tier 3, tier 2 types of challenges, but are really kind of beneficial for all. And I think if I think about my oldest son, who just did a presentation there yesterday as part of that, I can see some of that applicability there of some of the collaborative classroom discussions there where we can normalize those experiences, build in other opportunities for scaffolding, knowing that it's going to be essential for some of the kids who might be struggling with that, but also beneficial for everyone developing their skills and confidence kind of moving forward. So lastly here, just quick thank you to some of our community supports and funders. And my understanding, we've been working with them on a range of different videos to support parents. The London Community Foundation for some of their support, and City of London for Continuing Support Accessibility Fund for the clinic. MyTax, who's helped support some of our student research. Faculty of Education, some of the internal grants there have been really helpful getting us started, not only on these projects, but on some others. And certainly to some of our CYDC student clinicians and families. This has been a wonderful collaboration and partnership, and their feedback along the way has been really invaluable as part of continuing to develop and reflect on what we know works, certainly for individual students, but also the range of cases and circumstances out there as well. Yeah, so thank you so much for joining, and looks like we've got a couple minutes there, so we'd love to certainly kind of take any questions or reflections.
Thanks, Colin. That was a great talk. If anybody has any questions, you can use the chat window or feel free to unmute yourself and use your voice.
Hey, Colin, it's Janice.
Yes, hi Janice, how are you doing?
I'm good, thanks. How are you doing?
Good.
All right, thank you so much for that presentation. And my question might be actually if Chelsea's still around. Maybe it's more for Chelsea. But I was just wondering, you mentioned a book, Parent-Led CBT for Child Anxiety, and I was just wondering if that is something that you would recommend for parents who are dealing with a very anxious child, or whether there's something else that you're familiar with that would be a good option. I'm aware of the Anxiety Canada website, of course, and
Yeah.
I'm not sure whether you've got any sessions running in the near future. So just for parents who are dealing with a very anxious child, suggestions, just looking for any help.
Sure, I'd say for that particular book there, Janice, I would say it's probably more for clinicians to be working directly with parents.
Okay.
It's a little kind of text heavy and a little much more kind of meta in some of kind of the ideas and concepts. But in terms of certainly some other books there that I'd recommend, oh my goodness, Helping Free Your Anxious Child. So I'm looking at my books here. Tamar Chansky, she's one, yeah, Freeing Your Child from Anxiety is a great one that I would recommend.
Okay.
Lynn Lyons, so Lynnlyons. Lynn Lyons has a great number of books there that are very practical and parent-oriented. And certainly one of the things actually that we've done recently, Janice, is we have recorded some presentations there for parents that we'll be posting on our website in probably the near future there. So I'd be happy to send you a link there to that parent session if that would be beneficial.
That's awesome. That'd be great. Thank you.
No problem. And I know that we're working certainly with some of the Dr. Nicole Neal and Dr. Karen Bax there about this idea of developing a repository of often family-based kind of presentations that can be a good fit for them.
Super.
Great.
Thank you.
No problem.
Dawn, do you want to go ahead and ask your question?
Sure, thanks. Hi, Dr. King. My name is Dawn Fine. I work part-time at the faculty, but as well, I work with Thames Valley full-time. I'm working with the portfolio Safe Schools and Wellbeing, which,
wonderful.
let me tell you, was a challenging portfolio at this year particularly. Yeah, I'm wondering if you have any suggestions of really great resources for educators who are really desperately trying to help students who are feeling more than overwhelmed this year with anxiety and stress.
Yeah, that's great. I would really recommend the School Mental Health Ontario website. I know that they've put together, particularly some in the first 3 months, I think it was the first 90 days, of really, trying to normalize and introduce some of that emotional vocabulary into the classroom about, just, how we're all feeling at this, point in time of, to kind of invite those conversations and knowing that, hey, this is something we can invite that kind of elephant into the room and talk about and problem solve as a group.
Mm-hmm.
I guess I'd be a little bit curious there, Don, about perhaps even a little bit more specific about, is the students or teachers kind of feeling overwhelmed? I guess, what does that look like perhaps in terms of maybe some of the behaviors that you might be seeing?
Right. Well, we're seeing certainly a lot of what teachers are calling misbehavior, but we're relabeling often as a stress behavior that we're seeing in the classroom. Sometimes that's avoidance. Sometimes it's coming out in and acting out, or not paying attention to what they need to do and acting in ways that are causing disequilibrium for the whole class, and a lack of self-regulation for the students. And not all of our educators know how to co-regulate.
Yeah,
right?
absolutely. Yeah, no, and I mean, these are probably ideas that you're already kind of running into and using there, Don. I think, certainly some of the classroom-based discussion of, being able to work on some of the routines and practices there that are helping with some of that down regulation, often about, perhaps, whether it be after recess or after lunch, where just naturally kids are a little bit more animated and busy, and have a little bit more kind of, their beakers are a little bit more full at that moment.
Yep.
I think about some of those individual discussions with kiddos there too about, I really like some of the everyday classroom-based discussions, but, if there are some individual conversations about some more collaborative, personalized ways that might be helpful in that moment, being able to dig a little bit deeper as well. I mean, one of the things, certainly with that lens around anxiety, is just how personalized anxiety is. Is there thinking about more avoidant or off-task behaviors? What about that particular situation is feeling tough? What's tough about that? Is it the writing? Is it about the level of noise? But being able to dig a little bit deeper, because some of that description piece will really inform kind of what we're doing about potentially kind of modifying some of those demands there as well. I'd say,
great suggestions. Thank you.
No problem. It's a very challenging time. I know everyone's certainly kind of doing their best and in a very kind of difficult space right now.
Thank you.
Wonderful.
Thanks, Dawn. Are there any other questions?
I would say just, maybe in wrapping up there, Jen, just if you are interested, if you're involved in supporting families at all, or educators or youth there, if you log on the clinic website there, Child and Youth Development, you can subscribe to our mailing list. We often have different webinars that actually one later on tonight that we're doing for parents of adolescents there, but we often do have some ongoing PD, and hopeful that we can develop some other repositories there that can be some real kind of guided professional development and support for families too. So hopefully that will be forthcoming in the near future.
Thanks, Colin. We do have one more question. Jill, do you want to go ahead?
Oh, hey, can you hear me okay?
Yeah.
Yep, sounds good.
Can you hear me? Okay,
yes.
Okay, super. I just actually wanted to make a comment to Teacher Dawn about how grateful I am for the questions you asked Dr. King, because I'm a parent of teens, and I can't tell you how, a teacher being able to cue into those kinds of things and it just being negative behavior. I just want to send you some gratitude and thank you.
Thanks, Jill. Okay, so it's 2 o'clock, so we will wrap everything up. Thank you, everybody, for coming out today, and thank you, Colin, for his fantastic and very timely presentation. Our next faculty seminar will be Thursday, April 29th by Dr. Emma Durden about early life stress and the association with cognitive ability in school-age children. So hopefully everyone can make that session too. And again, we will record and post Dr. King's session for anybody who couldn't make it today. Thank you, everybody, and have a great rest of your afternoon.
Great, thank you.